gentleman, and then I'll do one more lady right here, and those will be our last two questions.
My name is Jesus Ramon. I'm a bilingual counselor, associate. And my question to you specifically is about mental health. The bottom line is we need more funding. With the border crisis, if I'm not, correct me if I'm wrong, they depleted a lot of funding from the human services to the border. And part of the program was to create fear, the machoism, so that they can vote for him, which leads to the white versus the Hispanics. And the bottom line is we have a big, pink, green elephant in the room that we must tackle it now. Uvalde is just the tip of the iceberg. It's going to happen here in Del Rio if we're not aware. It's going to happen in Eagle Pass because we're not addressing the real issue. We need more Hispanics representation within the government to represent our real needs of Latinos. They don't want us to vote. Plain and simple. The more ignorant, the more isolated, the more lack of information, the better for them. You know, it's a war of misinformation. But we're the majority minority in Texas and in the U.S. My question is, what are we going to do with the mental health issue? Because just like the young lady said over there, which is true, they see him as locals. They see him as people who are not well. But you have to take into account our culture. And we're importing different parts of our culture from Venezuela, Colombia, and we're trying to fit into the white dominant culture. And that has to be taken into consideration. The cultural intervention of helping our population thrive. So my question is, as governor, what are we going to do to help our Latino population, give them the recognition, the acknowledgement, but put them in places of representation where they can be decision makers, especially in the mental health?
Thank you so much for asking this question. And one thing that you said at the outset was the depletion of the already underfunded mental health care account. You know, when Governor Abbott went to Uvalde the day after the shooting, he went to the fundraiser first. Next day he comes to Uvalde. He says it could have been worse. And then he says this is a mental health care issue, which is strange because on his watch over the last 7.5 years, we've become 51st in the nation. And then the month before Uvalde, he takes $211 million out of the mental health care account of the state of Texas to play more of these theatrical games on the border instead of coming up with solutions for the real needs that we have here. No one's going to argue that we have needs here on the border. We absolutely do. But when it comes to mental health, in addition to the funding, which is really important that we just talked about in answer to the last question, where that funding goes and who has say over the disbursement of that funding is just as important, which is the point that you are making right now. When we were in Uvalde for the march that was organized by those parents that ended up in the Placita, somebody came to me who's a counselor in the community. She said, "Hey, Beto, despite all the attention we're getting, all this money that's been raised, we're running out of resources to take care of people in this community." When I talked to another teacher at Robb Elementary, it had been months since that shooting, still waiting to be able to get in to see a therapist. When I look at the communities of the border, which are 90, 95, 98% Mexican American, and we talk about a state that is the least insured in America, these are the least insured communities within the least insured state. So making sure that these communities are prioritized for that funding, and then we also have people in positions of power and public trust, whether it is Rochelle Garza as the AG, or those who direct funding for HHS in the state of Texas, or local mental health and public health authorities. I want to make sure that these resources get to where they need to be. One of the things that I've heard from these outstanding educators is that our elementary, middle, and high schools are a great place because they are a hub for the community to connect kids and sometimes their parents and siblings and even grandparents with the care that they otherwise would not be able to get or wouldn't begin to know where to find. So I want to follow your lead and the lead of others in the community who are willing to step up and to take this on and be your partner in the Capitol to get it done. Thanks for asking. Appreciate it. Thank you so much.